Hello, good morning and welcome everyone. Thank you for joining us today. This event is hosted and organized by Silent Scream Foundation, which is a nonprofit organization in Ghana that works in the field of mental health care access, awareness, and destigmatization on mental health issues. Today's event is a mental health awareness training on the topic bipolar disorder. We are joined by Mr. Richard Obinyentri, who is a nurse educator at Pantine Hospital in Accra. He's bringing his years of training and expertise to the conversation, and we are grateful to have him. Kindly note that the session is being recorded, so that it can be revisited by participants in the future. It will also be made available to those who cannot join us today. Please remember to keep your mics muted to avoid disruptions and feedback so that we can hear our speaker clearly. Kindly take notes of all questions that will come up while he is presenting. Please type any questions you have in the chat for our speaker so that they can be collated and presented to him. Finally, this event, like all the previous ones, is free. This is made possible through the work of the Silent Scream Foundation. Please find us on Facebook and LinkedIn at Silent Scream Foundation, or visit our website at silentscreamfoundation.org. Alternatively, you can also Google Silent Scream Foundation and the website should come up. You can learn more about what we do through these channels, and you can also like and share so that people will get to know what we do here and have access to the information that we provide. Thank you, and we hope to have an enjoyable and informative meeting. Mr. Richard, please, you can start.
Okay, thank you for having me. My name is Richard Obinyentri. I'm a psychiatric nurse by profession and then also a nurse educator at Pantine Hospital. Today we'll be discussing bipolar disorder. Our discussion or lesson will be around the definition, the types, the causes, treatment, and then complication if the time permits us. For the sake of time, we'll be dealing with the definition, the types, and the symptoms. In our next lesson, we'll continue with the causes, the prevalence, the treatment, and the complications. Bipolar is a mental disorder, as our lesson suggests. It's a severe mental disorder that is characterized by episodes of deep, prolonged, and profound depression that alternate with periods of abnormally elevated or irritable mood known as mania. And these phases, that's the mania and then the depression, last from days to weeks each. Alternatively, it's also a mental condition that causes extreme mood swings. And when we say extreme mood swings, the mood swings are the mania and the depression. It includes the emotional highs or the manic phase or hypomania phase, and the lows, that's the depression. And these two phases or symptoms should affect the individual's energy, activity levels, and ability to carry out his or her day-to-day activities. One thing we've noticed about mental illness, which the bipolar is also inclusive, is that they usually affect the individual's occupational or social functioning. And that's why most of the criteria for mental illness should affect the social or occupational function of the individual. For you to tell somebody or to note that someone is suffering from bipolar disorder, that disorder should affect his day-to-day activities. We should also take note that bipolar is a lifelong illness. So the episodes of the manic phase and the depressive phase will recur over time. You are unable to say that the person is alleviated from these symptoms entirely. No, it's never possible. Then between these episodes of mania and depression, the person will have a free symptoms phases. So there could be days, weeks, even months where the person will not be experiencing any of the symptoms mentioned above, or the mania or the depressive phase. However, some people may have lingering symptoms over time. So that's what we have to take note. Mental illness is not treated and then it's gone entirely. No. Anyone who tells you that is telling you a lie. It's a lifelong condition. So we treat it comes back just like we usually have malaria or other medical conditions. I have this picture to show how the bipolar phases are or the bipolar disorder is. So on the left side of the picture, there's someone who looks quite, let me say, cool, not having a problem. And then there's another side with a person having thought of suicide, thought of death. So you could see blood spilling on the right side of the picture. So that's how the condition is. The condition is having two distinct disorders, the mania and the depression, alternating within the individual. There's another picture I want to show you. So the same individual is having two different moods. One is saying fuck off, the other looks happy. So on the left side, you see the person becoming very sad. So whatever you want to do with the person doesn't seem interested. So it says fuck off. And then the other one is a laughing mode or a happy mode where the person is laughing with you. That's how the bipolar is. So we'll talk about the types of bipolar disorder. There are different books and the way they treat the types of bipolar. But basically, there are four main types of bipolar disorder. We have the bipolar 1, bipolar 2, the cyclosemic or cyclothemia, and then bipolar disorder not otherwise specified. So we're tackling these types as we go on. The first one we'll take is the bipolar 1 disorder. The bipolar 1 disorder is characterized by the occurrence of one or more manic episodes or mixed episodes of mania and major depression that last at least 1 week. We know that manic phases or mania is a condition that lasts at least 1 week. So the symptoms of the person experiencing the mania should last for a period of 1 week. And then with the bipolar 1, this manic phase is alternated with depression. And then the symptoms are severe enough to demand hospitalization or hospital care. And often, one or more major depressive episodes lasting at least 2 weeks is seen in the bipolar 1. So we have to know that the symptoms of mania or depression must be a major change from the person's normal behavior. What we mean by that is that for a person to be diagnosed of bipolar 1 disorder or bipolar, then the symptoms the person is exhibiting should be off her normal behavior she has been experiencing or showing prior to the time she started having the bipolar 1. So assuming from the day I was born, I was having a good mood, a normal mood. I was basically happy. If something is sad, I show the symptoms of sadness. If it's happy, I become happy. I don't just out of nowhere become extremely happy, giggling and all that. That's what we mean by the symptoms of mania or depression must be a major change from the person's normal behavior. So what you see in the individual as of that point should be a marked change in its usual behavior. Then we have the bipolar 2. The bipolar 2 is characterized by recurring major depressive episodes, either currently or in the past, and at least one hypomanic episode. So the main differences between the bipolar 1 and bipolar 2 is that for the bipolar 1, the manic episode is severe, or the person having a manic phase. The manic or mania is more severe than the hypomanic phase. Hypomania is similar to mania, but the duration is shorter. So for someone to be diagnosed of mania, he should meet a period of at least 1 week. For someone to also be diagnosed of hypomania, it should be at least 4 days. So with the bipolar 2, the main difference is that the person is having a hypomanic phase lasting for a period of 4 days. And the patient has never experienced symptoms that meet the criteria for a manic or mixed episode. So that's what I explained earlier. for someone to be diagnosed of bipolar 2, he should have episodes of hypomania, which is a lesser form of mania that is seen in bipolar 1. So bipolar 1, you have mania and then depression. With bipolar 2, you have hypomania and depression. Then we move on to the other type, the point 3, that's the cyclothymia or cyclosemic disorder. This is a mild form of bipolar disorder, and it's an episode of hypomania that shifts back and forth. So for a period of 2 years and up, the person will be experiencing these hypomanic symptoms. For days, you see the person having grandiosity, flight of ideas, racing thoughts, but that symptoms don't last for a week. Within 4 days, they subside and then the person comes back to normal. But it shifts back and forth with mild depression for at least 2 years. Then we have number 4, which is bipolar disorder, not otherwise specified. This is when someone shows symptoms of bipolar, but doesn't meet the diagnostic criteria for either bipolar 1 or bipolar 2. So we have bipolar 1 having mania and depression, bipolar 2 having hypomania and depression. With bipolar not otherwise specified, the person doesn't meet any of these criteria, but then the person is showing symptoms that may last long enough, or the person may have too few symptoms to be diagnosed with bipolar 1 or 2. However, the symptoms are clearly out of the person's normal range of behavior. So the person is showing symptoms of bipolar or symptoms that are not clearly of the person's own self. The person deviated from the normal self, but it doesn't meet either of bipolar 1 or bipolar 2. That's when we diagnose the person as having bipolar disorder, not otherwise specified. We'll continue with a picture showing the differences I spoke about of the bipolar 1 and bipolar 2. So for someone to have bipolar 1, the person should have at least 1 manic or mixed episode. So you have the mania, the red part, that's the ascent of the curve. You see that the ascension of the curve is more towards the mania with the bipolar 1. And then the depression is with the blue color that descends or depresses. So the person goes to a severe depression. If you see where the curve is for the depression, the blue one, you see that the curve is more towards the severe depression. And with the pink or red one, the curve hits the mania phase of the bipolar 1. With bipolar 2, the person never has experience of the manic episode or manic phase, but there's at least one hypomanic episode. So if you look at the diagram on the right of the bipolar 2, the curve is more towards the hypomania phase or hypomanic phase. And then there's evidence of severe or mild depression on the depressive phase. That's the blue one. And then with the time, the manic phase should last for a period of, if you take the bipolar 1 at the top, the manic phase should last for a period of 1 week. The depression should last for a period of 2 weeks. When you come to the bipolar 2, the hypomania lasts for a period of 4 days, while the depression still lasts for a period of 2 weeks. There's another picture I want to show with the same, it's basically talks about this, what I discussed earlier on. You have a person, an average person with the mania phase or the manic phase, and then the duration I spoke about is indicated at the top, and then the duration for the depression is also indicated below, and then the hypomania phase is within these two. So for someone to be diagnosed of bipolar 1, then the manic phase should be high enough for a period of duration of 1 week. And then the depression with bipolar 1 should also last for, a major depression should last for a period of 2 weeks. And these moves alternate. That's why you see the diagram like that. The person will be having episodes of mania for a week, and then bipolar for 2 weeks, which alternates like that. We move on to the symptoms a person with bipolar 1 will be experiencing. So I've divided the symptoms into 2. We have the mood changes and then behavioral changes. And then we have the symptoms for mania or manic episode, and then symptoms of depression or depressive episodes. With the mood changes for mania, there should be a long period of feeling high or an euphoric or outgoing mood. What we mean by this is that the person becomes extremely happy. For a period of 1 week, the person is extremely happy, and then this happiness is abnormal. It is persistent and it's very distinct. The period of happiness or euphoria is very distinct, is abnormal, and it is persistent. And then the person also exhibits extremely irritable mood. The least thing, a person is angry for the whole period of 1 week. And this thing is almost always on a daily basis. For you to know that someone is suffering from bipolar in a manic phase, these symptoms should be seen every day, and it should not be caused by any other mental illness or any other condition, any other medication. There's agitation. The least thing, the person is agitated. The person wants to fight. The person feels jumpy or wired. When we say jumpy, the person is a form of extreme happiness. I think I don't even know how to explain it, but the person is outgoing, the person is free, the person is wild. Anything the person wants to do, that's feeling jumpy or wild. And then when it comes to the depressive phase or the depressive episode, there's a long, abnormally and persistent period of feeling worried or empty. The person is very sad, very empty, and very depressed. So there's hopelessness, there's feelings of sadness and all that. And then there's also loss of interest in activities of daily living. So the person doesn't want to bath, doesn't want to eat, doesn't want to talk to anybody, doesn't want to go to work. The person loses those interests in activities of daily, brushing their teeth and all that. There's also loss of interest in activities of daily living or pleasurable activities, including sex. So with people having or going through the depressive phase of bipolar, if you even show them any pleasurable activities or any pleasurable things, they don't seem interested. Let's go to the beach. The person will tell you, no, I'm not into it. I don't feel like going to the beach. Let's go to a party. Let's go to an outdooring. All these things, for that period of 2 weeks, the person doesn't seem interested in those things, even if given those activities or shown those activities. So that's that with the mood changes of the depressive phase. We move on to the behavioral changes in mania and then depression. Some of the behaviors that change in the manic phase is that they talk very, very fast. They jump from one idea to another, otherwise stated as flight of ideas. So the person in the manic phase will be talking very, very fast for you to...
Could you not buy?
The person talks very, very fast. The person jumps from one idea to another. So the person, you speak with the person and then you can only tell the person to repeat what he or she is saying. What did you say? What did you say? Because the speech is very, very fast. And then the ideas jump from one to another. They'll be telling you something about a story. And then all of a sudden, they'll be telling you something about themselves. All of a sudden, they will jump from that idea or that thought to another thing. And they are easily distracted. People in the manic phase or the hypomanic phase are easily distracted. So the least thing, they change from what they were doing to another thing. That's the distractibility. And then they become very restless. They can't sit at one place. They move from one point to another, walking up and down. If you come to the ward and you see a typical patient in a manic phase, they can't sit down. They'll be moving up and down. You offer the person a seat and then he doesn't sit down. even to the point of eating. They don't usually eat. So sometimes they lose weight. And there's little need for sleep with people going through the manic phase. And all these things I'm talking about should happen every day. You should see these symptoms every day of the person, which is not seen previously. And there's increase in goal-directed activities. So they tend to engage in new projects. The person will just go and buy a house. The person wants to do new things, dash his items and buy new clothes. They always want to take new projects. And they have unrealistic beliefs in one's abilities. I can drive from here to Kumasi. I can overtake this car. I can drink the entire barrel of water. There is unrealistic belief in their abilities. They feel on top of the world. They can do almost everything in their capacity. And they also engage in high-risk behaviors. Example, spending spree. They have impulsive sex. They go out sleeping with people. This happens in both sexes. So you see a lady telling you, oh, for the past 1 week, I've slept with about 7 guys. You see a guy telling you, for the past 1 week, I've slept with about 10 girls. These are some of the symptoms we see in them. And then they invest, they have this impulsive business investment. They tend to give out their money into investment that they don't even have second thought of. And then they engage in a lot of pleasurable activities, going to the beach, outdooring, parties. They throw parties around almost every day. They want to engage in something that will make them feel important. And they become very, very grandiose, the same as the self-importance. These are the symptoms people show when they are in the manic phase. And these symptoms should be present for almost every day for the period of 1 week for you to know that the person is really suffering from bipolar 1 and in the manic phase. We move on to the depressive phase of the bipolar. So people having depression in bipolar disorder will preoccupy themselves with death, suicide, and they even go on to attempt a suicide or create a suicide itself to the cause of death. So the person will be telling you, I feel empty, I don't feel like I belong to this world, I want to end my life. They'll be dashing their things out. So some of the symptoms we usually note from them when they want to commit a suicide, you see them selling their phones, selling their TV, dashing their items out, and then telling you, I feel empty, I want to die, I want to end my life. These are some of the symptoms that will let you know that someone is really suffering from depression and in the bipolar phase. Then they have poor concentration and attention. They are restless and irritable, just as we see in the manic phase. But then they have decreased energy compared to the manic phase. One other thing is that even though they have decreased energy, they tend to have some energy which helps them commit the suicide. So even though we are saying that with the depressive phase, clients are usually having decreased energy, they tend to gain some energy in some time of the weeks or the phase of the condition when they're having a bipolar or the depressive phase. And it is this time that they usually commit the suicide. So we have to take note when we see people in the depressive phase. You see them being sad, very quiet, sitting, not talking to anybody. But all of a sudden, they tend to have some increased energy where they use that energy to commit the suicide. They have feelings of guilt, hopelessness, worthlessness, helplessness, and all that. So the person will be telling you they feel like they've done something wrong. Whilst they've not done for you, they've not done anything bad for the past months, past 2 months. But because of the depression, they have that feelings of guilt, feelings of hopelessness. I can't do anything. My family don't like me. I'm not worthless. I'm worthless. I'm not worth of doing anything. I can't even learn. I can't pass my exams. I'm empty-headed. They'll be telling you some of this stuff for you to know. Usually, sometimes they don't tell you. Sometimes you observe them saying it. Sometimes you observe them through their behaviors. So some of these symptoms are not voiced out by the patient. There are some that you observe through their behavior. That's why we say the behavioral changes. You see through their behaviors. They become very sad, withdrawn. You tell them to do something, they will tell you, I can't do it. I don't think I can do it. That should let you know that the person is feeling hopeless and helpless. Can you do this? No, I can't do unless you help me. And that particular task is something that you know the person can do it by himself. So some of these things should be very noted when dealing with this patient. They don't always say it. You see it from them. It's something that we observe. Then there's changes in eating and sleeping habits, and all these things are observed through their behaviors. So the person has or usually had about 6 to 8 hours of sleep. With depression in the bipolar disorder, they'll be having about 10 or 12 hours of sleep. That's change in eating or sleeping habits. And then if the person used to eat a bowl of banku or 2 balls of banku, you see the person sometimes with the changes in eating, it's either the eating is increased or decreased. So we have to take note of that. It's not always decrease in the sleep or decrease in eating. There are some that they have increase in eating habits or increase in sleeping. So I'm saying this because if you take the eating habits, the person might be having more eating. Supposing he was eating a bowl of benku, with a depressive phase in bipolar disorder, they might be eating 2 bowls of benku or half benku. If they eat a bowl of rice, they might be now eating a bowl and half of rice or half a bowl of rice. With the sleeping habit too, it could be that they were having 6 to 8 hours of sleep. Now they have only 4 hours of sleep or more than 8 hours of sleep. There's significant weight gain or weight loss. And that's why I was talking about the food. With the bipolar disorder, the depressive phase has either weight gain or weight loss because of change in appetite and change in eating habits. So we've summed up some of the bipolar symptoms in this slide, which shows the manic episode of the person. So at the top level of the pictures, on the extreme left, you see the person feeling overly happy for long periods of time. And this happiness is on a daily basis. We have to take note. It should not be the ideal behavior of the person as you knew him or you know him. They talk very fast with racing thoughts. They jump from one thought to another. They become easily distracted. So the person is unable to learn, unable to concentrate. They have poor concentration and attention. They have overconfidence in abilities. They misjudge their potential. They engage in risky behaviors, as we taught earlier. For example, they are gambling, betting. You know the person not to be a bet guy, but now they've entered into gambling. They put almost everything, they put money on everything that they do. I can do this. Put money on this and I'll do it for you. So we'll go to the depressive episode in the bipolar disorder. And then I'm talking about the second part of the picture where you have the person feeling sad or hopeless for a long period of time. So you have to take note that there's almost always a long period of time. And this long periods of time should be on a daily basis. The symptoms should be present on a daily basis or almost on a daily basis. For the 2-week period, the person should be showing these symptoms in the depressive phase. In the 1-week period of the manic phase, it should show all these behaviors on almost a daily basis. There's significant change in appetite. That's the change in eating habits. And then there's thinking about attempting suicide or committing suicide itself. There's feeling of fatigue or lack of energy. They don't want to do anything. You tell the person to go and bath and he feels so lazy. If you don't take care, you might think the person is lazy. No, it's the condition that is making the person exhibit that kind of laziness due to lack of energy or lack of drive to do anything. There's problems with memory and concentration. So they have poor concentration, attention, and then memory. You tell the person something today, within the period of 2 weeks where the symptoms is manifesting. or exhibit, he or she is exhibiting the symptoms, the person is unable to remember what you told him or her. If you are chatting with the person looks absent-minded in the depressive phase, and it's same with the manic phase too. They have, both of the phases have poor attention and concentration. So there's another slide that talks about the depressive and manic phase. So basically, these are all symptoms of the manic and depressive phases. I think we've talked about them all, the depressive symptoms and the manic symptoms. And then I would like to talk about some of the symptoms with children. Some of the children do exhibit symptoms that we might think they're having temper tantrum, just childhood behaviors. But some of them do exhibit some of these disorders that we don't know about. And that is why I've included it in the slide, so that we tend to know when our children are exhibiting some behaviors that are normal from, they are abnormal or not normal from the norm. Some include, so this one is for Children and Adolescent Bipolar Foundation in 2007. They rage and then they exhibit extreme temper tantrum. So we know that children usually exhibit temper tantrum. When they need something, I need toffee, you don't buy the toffee for them. They throw themselves around, disgracing you in the shopping malls and all that. But in this case, they have extreme. One thing about mental illness that we have to take note is that everything is in the extreme. So extreme raging, extreme temper tantrums. There's rapid changes in mood over hours or days. Rapid change in mood. So the person is happy today and tomorrow. The next moment, the next 3 or 4 days, they are extremely sad. They don't want to do anything. They are easily set off by environmental or emotional stresses. So something that will not stress you that much, they are easily stressed by that, those environmental, emotional stresses. Example is like homework. So we all know children come with homework, but they are easily stressed with homework. Go and bath and they don't feel like bathing. They see bathing to be a very huge task for them. Then there's hard time waking up in the morning, just like we see the depressive mode in the bipolar 1 and bipolar 2. They are defiant and oppositional behaviors. There's aggressive behaviors, sometimes through their speech, shouting at someone or shouting at the parents, shouting at their siblings. They usually have nightmares or bedwetting. They are hypersexual behavior, especially in the adolescent years. And then they become obsessive or compulsive. When we say obsessive or compulsive, they tend to be very strict in their behaviors. And then these strict behaviors are shown or recur over time. So they close the door and then all of a sudden they think they didn't close the door. They go back and check. They've done their homework. They think they didn't do their homework. They take the bag, open the bag and check whether they've done the homework. They take the keys. They are these compulsive behaviors and obsession to do something, bath maybe 4 times in a day. And they are daredevils, just as we saw in the manic phase of the bipolar disorder. They take risky behaviors, and then sometimes you see children or adolescents jumping from cars, want to jump up high for a car to pass under them. These are all daredevil behaviors. Jumping from story building, trying to know whether they can land well. All these behaviors sometimes, I use the word sometimes, traces of bipolar 1 in adolescents. They are interested in violent or morbid topics of death, topics of violence. They are very, very manipulative, and they are excessively bossy or bullying. And these are mostly seen in the adolescent years or those SHS high school years. You find some of the students becoming very bossy, bullying their other comrades in the school. They appear excessively silly or goofy. They create some behaviors of silliness, sometimes laughing their teachers, laughing their parents, and all that. So today we'll end our topic here. We wanted to discuss the bipolar, the definition, then we talk about the types and the symptoms. So that's where we'll bring our topic to. In our next lesson, we'll continue with the causes, the prevalence, and then the treatment and complication of bipolar disorder. Thank you so much.
Thank you. Thank you, Mr. Richard. So this is now our opportunity to ask our questions. Any thoughts you had while he was speaking, can kindly type it in the chat. We'll collate it together and then present them to him. And Mr. Richard, please, there's a question in the chat that's asking about initiatives that can improve understanding of mental health conditions and increasing access to healthcare, especially for those in the developing countries. The person is also asking what activities can help with mental health.
So I wish that question will be put down in our next lesson, because we have all those things. Because of the treatment purpose, all those things they fall under the treatment. And the person will very well appreciate that when we are dealing with the treatment or the treatment modalities.
Okay.
Yes, please.
Okay, there's another question that's asking about when you said that this mental disorder is a lifelong illness. And the
Yes.
person is asking, so how do you help someone to manage it throughout the course of their life? And how do you make sure they stay on their medication without going off if they feel they are getting better?
Okay. So I think most of the questions are pertaining to treatment.
Yes.
Yes. So let's tackle it. Okay. So one thing is people who have mental disorders usually don't see themselves having the disorder. So we do psychotherapy or psychoeducation for them. And with this psychoeducation, we involve the family members in the counseling session. So we have family therapy as part of the psychotherapy. It's a form of psychotherapy. This is where we sit the family down, educate them on the cause of the condition, what they will do to help the individual. So the family members need to understand the condition the person is suffering from. When they understand the condition, they're able to provide more help for the family member. Do you understand? Because we don't do only medical treatment based on drugs. We combine those things with the psychotherapy, the electroconvulsive therapy, and all that. So the family is included in the therapy. Please, are we getting it?
Yes, please.
Yes.
Okay.
If I'm not on course, he can draw my attention and then I can come back.
Okay. Please, there's a question that says that some of the symptoms that were listed at the Mania side just seems like someone who is the life of the party, someone who everyone is excited to be around. So how do you notice, I think, okay, the question is long, so let me try to rephrase it. The person is essentially saying that
yes,
during the depression side, the person will isolate themselves. So usually you will not know that this is what they are going through. But this is during the mania side, they come out and they're excited. So your perception of them is just that they are just a very excited person who makes everyone happy. But you don't know that this is what they deal with during the depression side. So how do you notice this, essentially?
So the person wants to know how you notice the manic phase or the depressive phase.
I think the depressive, because the person is saying during the depressive, the person will isolate themselves and then go home. That one, they won't show it out. But then the mania, they will rather come out and then have fun with everyone. So your perception of them is that every time you see them, they are happy. But you don't know that when they go indoors, they experience that depressive phase. I think that's
okay. Okay, so I think I have to explain well to the person to understand. Mental health conditions, there are criteria for diagnosing someone with a mental disorder. There are criteria. For the sake of time and for the sake of the lesson, I didn't include some of those things. I just include the symptoms because the criteria itself is a whole lesson altogether for you to understand the criteria. But let's just rush through it. For someone to be diagnosed of bipolar disorder, the person should meet a certain criteria with these two phases. That's the manic phase or the depressive phase. So if you want to know that someone is having bipolar disorder, the person should deviate from her normal self. With the manic phase, the person should show the symptoms of this abnormally persistent and then a distinct period of elevated mood for a period of 1 week. So whilst I was teaching, I was saying that we should note the time and then the symptoms. The symptoms should be persistent. It should be persistent and it should be abnormal. So we all know the person not to be showing this kind of symptoms for in the past. I don't know whether he's getting me. We should be able to know that for the past time that we knew the person wasn't showing any symptoms of abnormally elevated mood or irritable mood. The person wasn't having increased energy. But in this current instance, the person suddenly is having this abnormally elevated or persistent irritable mood for a period of 1 week. The person is having increased energy. The person is having inflated self-esteem or being grandiose. The person feels like he's on top of the world. The person belittles everybody for that particular time period, which you've never seen in the person. This is when you know that the person is having a problem of mental illness. That's the criteria. So for the manic phase, within that week, within that 1 week, it should last at least. So it could be more, but at least within a week, there should be that sense of grandiosity or elevated self. The person should be very talkative, having some precious speech. The person talks very, very fast. And then the person should be very distractive. There's poor attention and concentration for that period of 1 week. And after this 1 week, it alternates with 2 weeks of depression. So in a month, within a month, when you say these two things, you are able to know that, oh, okay, this person is having bipolar. That's the criteria that you can use to know that the person is having bipolar disorder. So it's not just like the person is very outgoing and all that. No, the person is normally outgoing. We are all outgoing people. We sometimes feel sad when there's a loss of a loved one, when we lose something, you've lost your phone, it's normal to be sad. But if the loss of your phone makes you become extremely sad, the emphasis of the word is extremely sad, for a period of 2 weeks, every day, you are unable, and these things almost always impairs your social or occupational functioning. The loss of your phone, the loss of your mom, the loss of your dad, the loss of your boyfriend or husband is impairing your social function. You're unable to go to work. You don't seem talking to anybody for 2 weeks. And then it alternates with mania. If the loss of your parent or loved one makes you extremely sad for 2 weeks, you only have what we term as depression. You don't have bipolar. Bipolar is when you have both manic and depressive phase alternating within these weeks that we've mentioned. So the person has a manic phase of 1 week. In the subsequent 2 weeks, he's exhibiting severe depression. Then we diagnose the person having bipolar and not just depression or not just mania. Please, are we clear with that?
Yeah.
Yes.
Thank you.
You're welcome.
Okay, there are a few questions here about preventing bipolar, if it can be prevented, or what measures you can take, and then how you can prevent it from relapsing after you've been diagnosed.
Oh, okay. So with the prevention, sometimes it's hard preventing mental illness because we are all prone to mental illness. There are certain scenarios that people go through that makes them suffer from mental illness. So with the prevention, what we usually talk about is a good social relation. So there's this good social support system in the society, in the family, at the workplace, because when someone exhibits psychiatric symptoms, if the person doesn't have friends, families, and peers to help him, it's very difficult for the person to recover. So if the support system is very good, you tend to prevent it. And then you don't engage in this peer pressure groups, substance smoking, because all those things are the risk factors in psychiatric mental illnesses, especially smoking, substance use and abuse. I think basically alcoholism, these all fall under substance use. So, and then poverty. These are risk factors that sometimes we can prevent, sometimes it's difficult to prevent. So the prevention, we'll talk about maybe seeking good job for you to have a better lifestyle, not engaging in substance use and then abuse or alcoholism, having good support system and all that. These are ways to prevent mental illness. But then mental illness can come on anybody at any time. That's one thing we have to also understand. It comes at any time in a person's life. Nobody is immune to mental illness. So the good support system, not engaging in substance use and abuse, and then alcoholism and all that are a few I can mention to help you prevent mental illness.
Okay, thank you.
Yes, please.
Someone is asking about, okay, let me read this one first. The person says they understand that dance and art therapies can help the condition. And where in Ghana can people access these?
Primarily, I don't know any centers, but I think there are individual dance groups. Like I have seen this DWP Academy. I don't know where they are though, but I think they are based in Accra. And for the arts, if you are someone who likes arts, then you can engage in buying those, what's the name? They have this painting, they have a word for that. So you buy your brush, but for where they do it, I think, unless we find out from the art center, where they can tell you which group or facilities that you can really go to. For the dancing group, I know of DWP Academy and other dancing group, the salsa, you can engage in salsa and all that.
Okay, thank you. Someone is asking, how do you help a person who has these symptoms but is not willing to seek professional care?
How do you help the person? If the person is unwilling to seek professional care or professional help, then it's very difficult helping the person because you are not a psychiatrist. Bipolar is, as I mentioned earlier, if we go back to the definition, is a severe mental disorder. It's a severe mental disorder. So if you are not specialized in these areas, it's very, very difficult for you to help the person. You can just offer emotional and social help, but that one wouldn't let the person come through because the person needs medication and combined therapy or family therapy, cognitive behavioral therapies, and even a therapy called electroconvulsive therapy. And all these therapies you can't offer to the person. So if the person is willing to seek medical or psychiatric help, it will be very, very difficult.
Okay, thank you.
You can just provide emotional support, as in understanding the condition, letting a person know how he or she is feeling. You feel like you are in the situation of the person. These are on the support system or support things you can do for the person, but it wouldn't let the person go out of the symptoms as will be if the person is hospitalized, because this condition usually end up people in hospitals and then they are admitted for treatment. So just support treatment will just not be enough. Yes.
Okay, someone is saying that why do most establishments assume medication is a solution when it only suppresses things for a short period?
Okay, so most establishments do that because in in the biologic causes of mental illness, we've noticed that certain areas of the brain are affected when people suffer from mental illness. And if certain areas of the brain are affected, including the neurotransmitters that send impulses to certain areas of the body, then the only thing you can do is to combine medical treatments or drugs or medications to treat these specific areas of the brain to alleviate the symptoms the person is presenting. That's why most of the conditions are usually treated with medications, because they've done researches to understand where in the brain that these problems are arising or coming from. And when the person is given medication to, this medication suppresses those centers, and then the symptoms are also suppressed inadvertently. So that's why most establishments or institutions use medical treatment or medications as a first line of treatment before the supportive or the other combined therapies are added.
Okay, thank you. Someone has their hand up. I don't know, maybe the person wants to ask the question themselves. Falira, please, if you are able to unmute and ask, you can do so. I don't know if maybe it's a mistake or the person wants to.
Okay, hello. It's not a mistake.
Okay, sure.
I'm unable to type my question. That's why I just wanted to ask it. So can you hear me, please?
Yes, please, I do.
Okay. I wanted to find out what's the difference between bipolar and someone with a split personality disorder. I wanted to know what the difference are.
Okay, so personality disorders are different from bipolar disorder. With personality disorders, there are some behaviors that the person shows. With split personality disorder, something like dissociative, the person has, it's almost look as if the person is masking or, what's the word? Let me use masking. It's masking these behaviors. With bipolar, what we know is that the disorder is not from any substance use, it's not from any medication. Please, are you getting me? Hello?
Yes, I think, yeah.
Yes. So with bipolar disorder, what we know is that within the 3 weeks period, within just 3 weeks period, the person suddenly, right? The person suddenly exhibits symptoms of mania, and it alternates with symptoms of depression. And this could be a sudden onset. With personality disorders, some of these symptoms are right from a particular year of the person, and it's just with the person over time, because the personality is the sum total of the individual, the behavior, the speech, and all that. So it's quite different from excuse me, it's quite different from bipolar disorder. I don't know whether I'm able to convince you enough.
Probably maybe I should help if I understand what you're saying.
You perfectly have.
Okay.
So
Yeah,
what you're saying is that for one, that is who the person is. The split disorder, that's who the person is. But for bipolar, it is just for a specific period of time that the person exhibits this. Did I sum that up well?
Yes, you did.
Thank you.
Okay, I am confused now. So if you say with split personality disorder, that's what the person is. What does that mean? Because from what you were saying earlier on, I thought it meant that you are a certain person and you're trying to mask it. So 1 minute you are like this, the next minute you are like this. That's how I understood it. But now if you say that's who the person is, or that's what the person is, I get
Okay.
it.
Okay, so I have to make it known to you that personality disorders are different from bipolar disorders. With personality disorders, and especially with the split personality disorder that you are talking about, is usually the usual term people know it is dissociative personality disorders or multiple personality disorders. With these disorders, with this multiple personality disorder, the person is having two distinct personalities. And these two personalities have their own, let me see, self-identity and then perceptions. This is not bipolar disorder. So the person with multiple personality disorder will not be exhibiting depression and mania. No, the person has two distinct personalities in himself. So the person can be very, very tricky, can be very, very good. These are personality disorders. And these are multiple personality disorders that we are talking about. So it's not with depression or mania, no. It is how the person behaves towards you. So usually, these are persons we usually show in the house and in school. If I want to give you a typical example, someone will be very, very good in the house. He will be saying, please, Mama, please, I want to eat this. Mama, please, I want to go out. When a person goes to school or goes out of the home, they show a typically different personality altogether. So you'll be saying that, hey, is it not this boy I saw in the house just laying prostrate for the father and then greeting the old man, fetching water for the mom? These are personality disorders. Please, do you understand me?
Perfectly
Yes.
now. Yeah.
So these are the person having multiple personalities. You can see the person to be this, and another time to the person is doing this. Musicians, I can give you an example like musicians. Some people use the word alter ego. So musicians sometimes do have that. They come on stage, they look as if they've smoked weed, and then you see them another time too. They are that normal human being, dressing normal. When they come on stage, they dress differently. You see them to be, this guy is maybe a smoker or something else. But then in their normal life, they are that calm, cool type. These are personality disorders. It's different from bipolar disorder. Bipolar disorder is just a mood disorder. It's your mood. It's your mood that changes. And the mood changes affect your personality, the way you talk, the way you behave, and all that. With personality disorders, you are showing two distinct behaviors altogether.
Okay.
Yes.
Thank you.
You're welcome.
Thank you.
I think, okay, I think we have time for only one more question. There's someone asking, is there a multiple polar disorder? I think maybe other than the mania and then the depression, are there other moods that can?
So we are talking about, today we are talking about bipolar. That's why we listed the types of bipolar. Some books will say unipolar, just unipolar, and then they list other things. Some books will also give you the bipolar 1 or bipolar 2. So some books will write unipolar and then bipolar. With the unipolar, the person will be exhibiting, I think I have that one in one of the slides. So when you look at this slide, we have the unipolar. The person has only the depression, and it's on it with some slight differences of hypomania. It's just like the bipolar 2, but the depression is more than the other, either the hypomania or mania. So in some books, you see unipolar depression, bipolar 1, bipolar 2, and cyclothymia. In other books too, you see just bipolar 1, bipolar 2, cyclothymia, and then bipolar not otherwise specified. So these are just with books, different books with the same thing, but in different ways they explain it. Yes.
Okay, thank you.
You're welcome.
Okay, so I think we'll have to end here. We've gotten to our 1 hour mark, so just to respect everyone's time and including our presenter, we will wrap up here. So these are the last few announcements. I want to thank everyone for joining us today. And we know that people who are joining us all across Africa, from Sierra Leone, Egypt, Nigeria, all across the continent. I want to thank you all for making time to be with us today. On the 29th of this month, 29th October, we will be having an interactive session on Zoom where people can come in, share their thoughts and questions on mental health issues. It will be an opportunity for people to talk freely. So the details will be shared through our normal social media channels, Facebook, LinkedIn, the website, WhatsApp. So kindly keep an eye on those to find more information about that event. The session, of course, was